Bodies found after Ebola health workers go missing in Guinea. Team spreading awareness of deadly virus set upon by angry residents in remote village. Guinea officials said that they have found 8 bodies after a team of health workers went missing during a push to raise awareness of the outbreak of Ebola, which started in the country 9 months ago. 6 members of the team, 3 journalists and the director and 2 senior doctors of the regional hospital, were set upon by angry residents in the remote village of Womey, where many remain in denial about the disease, or suspicious of foreign health workers. The 6 have been missing since Tuesday. Officials said all 6 were held captive, although attempts to reach them stalled after angry residents destroyed bridges leading to the village. The meeting started off well. The traditional chiefs welcomed the delegation with 10 kola nuts as a traditional greeting, said a local resident who was present at the meeting earlier this week and gave only his first name, Yves. It was afterwards that some youths came out and started stoning them. They dragged some of them away and damaged their vehicles. A government spokesman, Demantang Albert Kamara, told Reuters, the 8 bodies were found in the village latrine. 3 of them had their throats slit. The Ebola outbreak across 5 West African countries has spiraled into the world's biggest ever epidemic, with more than 700 cases, out of roughly 5,300 overall, emerging in the past week alone, the World Health Organization said on Thursday. The WHO said there was a desperate shortage of health workers and supplies in an epidemic likely to last many more months. Health workers across Guinea, Liberia and Sierra Leone, where most of the cases are, have been periodically attacked by citizens in the region experiencing the deadly virus. For the first time, the district of Nzerekere, where the team disappeared, exploded in clashes after health workers tried to spray the local market last month. Some 50 people were arrested, and 24 police officers sent in to quell the riots were injured. In Sierra Leone, almost 30,000 volunteers will go house to house to raise awareness of the disease during a 3-day lockdown, when residents have been asked to remain at home. Thousands of soldiers are to enforce the curfew, due to start at midnight on Thursday. A sluggish international response to the crisis has picked up in recent days. The U.S. will send 3,000 troops to Liberia to help provide desperately needed boots on the ground in the country hardest hit by the outbreak. France's president, François Hollande, said the former colonial power would set up a military hospital to help tackle the disease in Guinea. After an emergency United Nations meeting on Thursday, Brice de Lavigne, director of operations at Médecins Sans Frontières, said, other countries must commit to deploying assets and staff to the affected region as soon as possible. It is impossible to predict if the current pledges are enough because we do not know how the situation will degenerate in the coming weeks. There's no response too large,